The use of narcotics is rising across America, and now there's a new threat to our children. Each year, thousands of babies are born exposed to dangerous substances like opioids and alcohol, all while safely tucked away in their mother's womb.
Neonatal abstinence syndrome can happen not only to opioids, but cocaine, other medications, heroin, obviously, any of the opioids like that. But it can happen with alcohol as well. The thing we see mostly, though, right now is opioids.
The National Institute on Drug Abuse says that a baby is born addicted every 15 minutes.
So a baby, when they are exposed to a substance in utero or while they're still inside their mother's body, when they are born, they are no longer have that substance on board. So just like an adult that withdraws from a medication or a substance that they've stopped using, the baby is also stopped using that substance as well. And so the same sort of feelings an adult has, the baby's going to have as well.
Those withdrawal symptoms are hard to watch and can be dangerous for your baby.
You can have mild on up to severe, everything from problems with sucking, nursing, congestion, coughing, vomiting, diarrhea, poor feeding, on up to seizures, which is obviously the most dangerous thing.
Just like adults that are withdrawing, babies tend to be a little more cranky. They may not sleep as well. Their body's sort of in overdrive trying to get through this withdrawal process, so their temperature may be increased. It's not that they're sick with a fever, but their body is just working in overdrive, kind of like when you work out at the gym, your body temperature goes up. So those babies tend to be a little warmer.
The rate of newborns diagnosed with drug withdrawal symptoms have increased well beyond 500% since 2004, with those numbers rising higher each year. While health experts don't know all of the long-term problems a child could face due to substance exposure, there are immediate health problems related to NAS. Things like premature birth, low birth weight, smaller than normal head size, heart defects, birth defects, and infections.
But even though the things that we're seeing, we're getting more adept at treating, there's still things that aren't known. I mean, long term, you're talking about things like babies with developmental delays, feeding problems, growth problems. So there's a lot of issues, I think, that probably are still in their infancy or childhood as far as what's going to happen in the future.
Typically, babies born with NAS can stay in the hospital 8 times longer. On average, that's 6 to 10 days in the nursery or the NICU.
Symptoms that would warrant that sort of extensive care is a baby that just cannot be consoled. Neonatal abstinence syndrome, like I said, it can last up to 7 to 10 days, usually peaks around day 4 or 5. Those babies are super just cranky and irritable. They may have an upset tummy. They may have diarrhea, and that may also in turn give them a diaper rash, and they're just very uncomfortable.
Parents of babies born addicted to illegal substances might also face legal issues. In some parts of the country, mothers could face charges, possible jail time, and have their babies placed with family or in foster care. So what happens when you're addicted to an illegal substance but you want help? Your first step will be talking to your obstetrician about getting help with the substance abuse in a way that is safe for you and your baby.
It's important to communicate with your doctor about the substances you're taking so that we can know how to not only care for you but also for your baby. Because as you know, babies can withdraw from anything from alcohol to depression medications, anxiety medications, medications for schizophrenia, and especially for opioids. Because without that knowledge, you may have a baby that you're treating and all of a sudden becomes ill and is breathing fast, is having fever, and you may be thinking the baby has an infection when actually they're withdrawing from opioids, which makes a big difference in how we're going to treat the baby, and can we keep them here, or are we going to have to send them to another facility in order to get morphine for withdrawal.
It's very important for moms to be open and honest with their providers about the medications and substances they're using while they're pregnant. Their providers can offer them different alternatives that can help the baby have better outcomes in the long run after delivery. An optimal situation would be for baby to be exposed to as little substance as possible towards the end of their pregnancy, and it will help them transition to life outside their mother's body a lot better.
Your doctor can help find the help you need to begin a new life as a recovering addict. You will be happier, healthier, and most importantly, a better parent. When it's time to deliver, your doctor will talk to you about what to expect. You will need to follow important guidelines to help your baby feel comfortable and healthy after birth as they experience withdrawal symptoms.
As far as babies born with NAS, I would tell any mother that the best things you can do is to care for the baby, love the baby, and do the things that any mom would do with a newborn baby, including swaddling, skin to skin, nursing, hugging the baby, caressing the baby, and the things that you know that makes a baby feel loved are the things that are important.
Some of the immediate complications from NAS can look like irritability, tremors, seizures, vomiting, and shrill crying. Of course, your doctor will diagnose long-term symptoms such as birth defects and help you understand his or her corresponding treatments.
It just takes a lot of love and patience to sort of love them through their crisis that they're in.
Quietly holding, breastfeeding, swaddling, and rocking your baby and limiting his or her exposure to light and sound could help reduce moderate to severe withdrawal symptoms.
We would like to encourage all moms to breastfeed their babies. It's very much a case-by-case sort of situation. If mom is using Subutex, Suboxone, Methadone, those sort of things to help with the opioid addiction, we very much encourage moms to breastfeed those babies, because those babies are still getting a tiny bit of the medication through the breast milk that helps them through that withdrawal process. It's more of a weaning process instead of cut them off cold turkey from that substance that they were dependent upon while they were still in their mother's body.
You're not alone in the struggle. There is help for you. Talking to your doctor or healthcare provider about the substances you may struggle with during pregnancy will help you and your baby.
There's always another day and always the opportunity for redemption.